So we're here to talk about health, wellness, and prevention. And before I do, I just want to say that they initially wanted me to get you guys up and active and do exercises, but I pulled the plug on that. But really, as healthcare leaders, what we say, what we do, how we act, has a tremendous impact on our patients, our family, and our friends. And we in healthcare need to be more than about acute care. We need to be about health, wellness, and prevention. And for those that know me, know that I'm very, very passionate about this, which is why Dr. Paul has cut me loose on the health and wellness redesign, which I'll show you a little bit about. But we really need to lead health, wellness, and prevention by what we do, how we act, and our lifestyles. And I just want to share a couple of things. If we can pull up the Keep the Beat challenge first. So recently, we just completed a challenge, and we're going to have a lot of these as the year goes on, year after year after year. They'll be more creative, they'll be more involved, they'll have all kind of really cool things. And so we just recently completed the Keep the Beat challenge to honor Heart Month, and it was February 1st through March 15th, and it was just completed. And I wanted to thank our team, Heartthrobs, which was Taylor, Ann Young, Jim Bross, and Dr. Paulus. And we placed 6th place overall, and there were over 60 teams. Not that that was great, but there were a lot of penalties if we didn't place in the top 15. We were going to be running around in spandex doing exercises around the hospital. So that was a real motive. And in fact, Taylor was the #1 steps walker on our team with over 520,000 steps. That's a lot of steps for Taylor. It's quite an accomplishment. And so we did well, and I'm really, and the reason that we did this is to set an example, because as busy executives, and we're all busy, not just the executives, but we're all so busy, to do this was a commitment, and that we wanted to show that it really is of value to us, as it should be to all of us in doing these types of challenges. So there are the 3 teams. The first place team was FDGers, and I'm not sure what that stands for. Do you know, Dee Dee?
I don't.
Okay. Get Moving, and these are all our colleagues from engineering to radiology, all around. And these teams walked a tremendous amount. They're just like the rest of us. Total steps for all participants were over 72 million. Or walking from Asheville to Los Angeles, California and back over 7 times. That's an incredible amount of steps for this challenge, and that's only a month and a half. Or walking over 34,000 miles. So these are our colleagues. They're all around the system, from every place in the system, just in a month and a half challenge. This is the example that we have to do, okay? This is just activity. And health, wellness, and prevention is more than about activity. So can I have the, so how many in here participate in on the MyHealthyLife WellConnect portal, been involved and logged in? So most of us. So I want to tell you some cool, exciting things that the health and wellness team are doing. So you may have seen some construction across from the hospital in that old Kerr Drug building. It used to be, I think, facilities. That's going to be the Mission Wellness Spa. It's going to open up next month. Some of you may or may not know about that. There's going to be movement classes, Zumba, yoga, massage, Tai Chi, a lot of classes that you could participate in just to get you active, get you engaged, and get you moving. This, I don't mind sharing my personal health information, but this is my my login for MyHealthyLife WellConnect. And what I wanted to do is show you some of the resources that you have available that you could look through and work with your teams on during the day. There are all kind of resources in here for stretching, the sort of time out that Karen took just to kind of level set and be quiet and just kind of get your mind refreshed. You can do a lot of things on the unit, on the floors with your teams to do this, and it really does make a difference. So when you log in, you see this. But if you go to Get Active, and you just go down here to Fit in 5. There are a bunch of videos in here in our partnership with the Western North Carolina YMCA that they recorded for us. You don't need to go to a gym. You don't need to have any special equipment. You can do a lot of these things at home in front of the TV or with music or with anyone, or even on your units. You can take portions of these videos, and I'm going to show you one in a second. I can't go through all of them, to help your teams just level set, get more active. And I will tell you, if there's one thing I want you to remember, and you'll remember this because I'm asking you to, and it'll resonate in your mind. Sitting around is the new cancer. Fast food is the new big tobacco. And you know, as you look at the source of chronic disease, and you go down the list and you look at what starts it all, it's inactivity, obesity, fast food. That's the source. You can go hypertension, you can look at the physiology of coronary disease, it all comes down to that. And so we must have a good and active lifestyle, from movement to the right food to the right lifestyle, and not wait till we're all in the ED or in the ICU. All of us have seen young people, and these are nice people too, because I don't think bad things only happen to nice people, right? Good people with devastating problems. And so we have to take, it's not a passive process. This is an active process. Maintaining your health and your wellness and your well-being is an active process. So if we go down to, I'm just going to click on this one and show you like 15 seconds.
Hello, my name is Diane Ciccone. I'm the Community Wellness Manager for the YMCA of Western North Carolina. And today I'm going to chat with you a little bit about some exercises that we can do for people who sit all day in their jobs or stand all day in their jobs that don't allow us many opportunities to stretch. And stretching is very important for us when we think about the fascial drag that happens when we sit all day or we stand all day, and it can lead to neck and shoulder pain and lower back pain over time. So to begin with, let's say if we're sitting all day, to get into the practice of sitting with your hips about halfway up on the chair and tucking the tummy in and lifting the pelvic floor. And so the lifting for the pelvic floor is terminology that is very difficult to understand for most people. So what works for me and many people too is the day after Thanksgiving, you go to put on your blue jeans to get out to the Black Friday sales, and all of a sudden the zipper doesn't zip and the button doesn't button. And so what do you have to do to get that button to button so you can wear those pants? So thinking about tucking in your tummy so that you can button that button to zip up your zipper. That's lifting your pelvic floor. And shoulders back and down. And so posture is the first thing that we want to think about when we're sitting all day in our chairs.
So I didn't want to go through the whole video, but you can go through these at home. I mean, this website's available both on MOD and then you can Google it, MyHealthyLife Well Connect, and get to it. Your unit secretaries, you know, everyone that's sitting around, you know, as leaders, just going up to them and, you know, and saying, have you been active? Or in a meeting, you know, standing up and stretching. It seems mundane, it seems somewhat ridiculous to certain people, but this is what we have to do as leaders. You know, it's being active, and I can't overemphasize this, is so important that the whole video game fad that's going on, it's not even a fad, it's probably part of culture right now, and all the online movies, it has affected our young people and our middle-aged people and so many people in such an adverse way that we have not yet seen the impact of it. For those of you to take care of children, we have children now with type 2 diabetes. When I was in medical school, it wasn't even in the literature. It didn't exist. Okay, so it's important. And we have a lot of resources on MyHealthyLife Well Connect website, and they keep adding to it. There's all kind of stretching exercises in there that you can go through. And so please, utilize the resource, be an example to your staff, ensure that they do it, and just be a nag about it because it's the right thing. So thank you. Thank you, Karen.